Denver 7 viewer Sue wants us to ask you about healthcare issues, and she has a two-part question. First, what do you have planned to bring down astronomical healthcare costs? And secondly, what is the plan to make sure that everyone will have access to affordable healthcare? Mr. Polis.
I'm glad she asked. So first of all, we want to use bundled payments through Medicaid like the state of Arkansas has used. It's effectively applying a Kaiser-type model to the state administration of Medicaid dollars. In Arkansas, it saved almost 30%. We want to have a state reinsurance for some of the highest cost cases to have a common risk pool like Alaska and Oregon did to prevent those cases from driving up rates for the rest of us. And yes, we need to take on the high cost of prescription drugs, because whether you pay for them directly out of pocket and you see that cost, or whether it's simply passed along to you in the form of higher insurance, Coloradans and Americans are tired of being ripped off. We want to use all the leverage we have, both as a state and working with other states, to negotiate better prescription drug prices and pass the savings along to hardworking Coloradans.
Treasurer Stapleton.
Well, we have a health care plan that improves access and affordability to health care for young Coloradans. In Western Colorado, 14 of 64 counties have one choice of health care provider. Some counties have seen premium increases of 70%. Young people are paying more for their health insurance than they are for their home mortgages or for their rent. We talked about investing more in mental health, working with all the different state agencies from HCPF to DHS to our Department of Insurance to actually help streamline the process of Medicaid expansion to deal with fraud and overbilling. But I have a big difference with Congressman Polis. He was a federal sponsor of a Medicare for All, a universal system. He believes in a single-payer system. Just go to his website. And that is a more expensive form of health care than we just defeated 2 years ago in a bipartisan way. He said that he supports payroll taxes. The payroll taxes 2 years ago were 10%. What are they going to be, 15, 20? Whatever they're going to be, Pizza Hut or Merrill Lynch wouldn't be doing business in Colorado anymore. And Vermont has already tried to lower the cost of prescription drugs from Canada, one of the tenets of your plan, and they found out they couldn't do it 3 years ago because Canada and the United States don't want to agree to it.
So Treasurer Stapleton, you brought up a subject that a Denver Post reader also brought up with us. Bill from Highlands Ranch has this question for Congressman Polis. Colorado overwhelmingly voted against single-payer health care 2 years ago, yet you are promising a single-payer system without any specifics. How would your plan be different from Amendment 69?
Well, again, I did not support Amendment 69. I think Coloradans agreed that it would drive up costs. Look, I look forward to working with Republicans and Democrats to save Coloradans money. This is not a partisan issue. It's not an ideological issue. It's an issue that I, for one, am tired of being ripped off. And you know what? When I meet with small businesses across the state, almost the first or second thing out of their mouth, whether it's a restaurant or a tech company, are the high cost of health care. So we want to work with our businesses to save money on health care. Again, I feel that the Medicaid bundling, the reinsurance program, saving money on prescription drugs alone are 25%, about a quarter of all healthcare costs. So if we can make a big dent in that and pass the savings along, not only will people have more money left in their pocket, but yes, we can use existing resources to expand coverage.
But
to reach we're almost there, Nick. We have about 7 or 8% of Coloradans that don't have health care. The only way to get to any type of universal health care coverage is to save money through better pricing on prescription drugs, bundled payments, and other increasing scope of care for nurses and nurse practitioners.
Is that a single-payer system, though?
I'm never caught up on the number of payers, whether it's 1 or 17. I want to make sure we cut administrative waste and pass the savings along to Colorado families.
Mr. Stapleton, you obviously want to step in here.
Well,
please.
I mean, that's just congressional speak for I don't have the foggiest idea how I'm going to pay for it. But I'm going to make false promises of free. It turns out when the government's budget becomes looser, the household budget becomes tighter. It's why I've met with the leadership at UC Health, Children's Hospital, who point out that the damage that Congressman Polis would do of a state-run healthcare system to research and innovation at UC Health, at Denver Health, at Children's Hospital, in rural Colorado, where we're struggling for docs as it is, it would result in less quality care, longer lines, less access to life-saving drugs, and his plans of having Canada lower drug prices. My running mate passed transparency in emergency room billing. I want to take that transparency across our healthcare network. I don't want to make false promises to people and not be able to deliver on them, because that's not compassionate, it's cruel. And I had my best friend when he was 12 died of cystic fibrosis. Under Congressman Polis, we wouldn't have the research and innovation that has actually extended his life.
Thank you.